Positioning the patient, getting the patient onto the operating table. The surgical team is partly responsible for the safety of the patient all the way onto and off the operating table. Be sure the basic rules of safety are being observed for some typical patient positions in surgery. The anesthetist is responsible for the patient's airway and should coordinate all moves of the patient to ensure it is maintained. Be sure not to dislodge IV cannulae, epidural sites, or existing drains. Use approved manual handling techniques, e.g., a pat slide or similar device, rather than lifting the patient. Be aware if extra care needs to be taken, e.g., prosthetic joints that may dislocate once protective muscle tone is lost during relaxation, unstable fractures, potentially unstable joints due to rheumatoid arthritis, existing ulcers, or skin lesions. Once in position, ensure that no points on the patient are in contact with the metal of the operating table to prevent diathermy exit point burns. Make sure bony prominences and areas of thin skin are well padded, e.g. the neck of the fibula in leg stirrups. Ensure any diathermy pad is correctly applied and not liable to be affected by skin preparation. Ensure there are appropriate supports for the patient to secure the position, particularly if the table may be moved, tilted, or rotated during the procedure, e.g. arm, thoracic, and abdominal supports for lateral positions, shoulder bolsters if the patient will be head down. For procedures requiring access to the perineum, be sure that the pelvis is properly supported, but that the perineum is exposed over the end of the operating table. Consider the positioning of ancillary equipment, e.g., where will video stacks be positioned? Is more than one energy source required, and where will the generators be located? Is there access of mobile imaging equipment or on-table radiography? All equipment positioning needs to allow enough access to the patient for the surgical team.